You're listening to A Small Dose. I'm Dr. Charlene McCormick, a registered pharmacist, and I'm here to provide you information on medication treatments for various diseases. My goal with this podcast is to provide you the information you need about your medication so you can make informed decisions and be in charge of your health. Disclaimer: the materials and content provided in this podcast is intended for general information only and are not to be considered a substitute for professional medical advice, diagnosis, or treatment. Hello, and welcome to A Small Dose, where we aim to provide you with the information you want to know about the medication you're prescribed. Today's Small Dose is all about Metformin. Metformin is a medication approved to treat type 2 diabetes. It is also used off-label for the prevention of diabetes as well as to treat polycystic ovarian syndrome, better known as PCOS. The majority of people taking this medication are using it to treat type 2 diabetes. It was reported in 2015 that a little over 30 million Americans have diabetes and roughly 84 million have prediabetes. What's worse is the number of children being diagnosed is steadily increasing. So with that being said, if you have diabetes, it is likely that you are currently on this medication or have at some point taken it. When you have diabetes, a few things may be going wrong in your body that is causing your blood sugar to be high. So first, your body may not be producing enough insulin to help regulate the amount of sugar in your blood. Second, your body's cells may not be responding properly to insulin. Third, a combination of the two may be occurring. Your body uses glucose as a form of energy. Your main source of this energy is by eating food, but your liver can also produce glucose. Metformin may be used by itself or in conjunction with other treatments to manage high blood sugar. Some of the brand names you may know this medication by are Glucophage, Fortimet, and Glumetza. Metformin is available in two forms, immediate release and extended release. The difference between these two has to do with the time it takes for the medication to dissolve and absorb in your bloodstream. Generally speaking, you take an immediate release version more times in the day than an extended release version. So how does metformin work? First, it helps to decrease the amount of glucose your liver makes. Second, it helps decrease the amount of glucose your intestines absorb from the food you eat. Third, it helps to improve your cell's sensitivity to insulin. In other words, your body responds better to the insulin it produces. The effects of metformin can be seen in a few days, but the max effect of it will be seen in about 2 weeks. There are some things that should be monitored when taking metformin, and just in general when you have high blood sugar. You'll at some point monitor your blood sugar at home using a glucometer. Glucometers are available without a prescription, but your doctor may prescribe you one in order for your insurance to cover the cost. The meters themselves aren't too bad cost-wise, but the strips can get expensive depending on the brand. This is why most people get a prescription so your insurance can be billed. If you find the price of your strips to be outrageous, check with your local or independent pharmacy for help selecting a more affordable option. Your meter will help you monitor your blood sugar levels. The recommended goals according to the American Diabetes Association are 80 to 130 milligrams per deciliter preprandial and less than 180 milligrams per deciliter postprandial. Preprandial is fancy talk for before a meal, and postprandial means after a meal. When you are testing after a meal, you want to wait until 2 hours after you've eaten to test. A1C is another term you may hear. A1C is an abbreviation for glycated hemoglobin. It is the percent of sugar that binds to the protein in your blood. So when you have consistently higher levels of blood sugar, your A1C will be higher. The American Diabetes Association recommends a goal of less than 7% when you have diabetes. It is important to mention that monitoring goals may be individualized based on your specific needs. Your particular goals may differ depending on your situation. For instance, if you are generally healthy other than diabetes or are a younger adult, your doctor may prefer stricter control and may want your A1C less than 6.5%. However, if you have some other specific conditions or are elderly, your doctor may be a little less strict with you and want your A1C less than 8%. Diabetes doesn't just affect your blood sugar level. There are other complications that can arise from having high blood sugar. For instance, damage can occur to your kidneys, so it is important that your kidney function is monitored by your doctor. Also, damage to nerve endings can cause pain and tingling in your hands and feet. This is known as diabetic neuropathy. Damage can also occur to the tiny blood vessels in your eyes, so you should have a dilated eye exam performed regularly. Tight control of your blood sugar levels can make a huge difference in preventing and managing these complications. Now for side effects. All medications have the potential to cause side effects. Not everyone will experience them, but it's always a good idea to be aware of what could happen with anything you take. With metformin, one of the irritating side effects has to do with gastrointestinal upset. I'm talking diarrhea, nausea, vomiting, and flatulence. This happens more so with the immediate release version, but is also possible with the extended release version. Your doctor will help alleviate this by starting you on a low dose so your body gets accustomed to this new medication, then gradually increase to the target dose over the first month. Generally speaking, if you can get past the first month, the symptoms should subside. I know this is not always comforting to hear when you're the one experiencing the side effects. You know your body, so listen to it. If you are experiencing side effects or anything that you feel is not normal for you, please seek medical advice from your doctor or pharmacist. Now let's talk about what this will cost you. Medications in general can be expensive, but in the grand scheme of medication costs, metformin is fairly affordable. Most insurance companies will cover this medication because several manufacturers produce the generic form. The extended release version can be more costly, especially if your doctor prescribes for the brand name, allowing for no substitutions. If you don't have prescription coverage with your insurance, or you don't have insurance, I would recommend you check the cost with your local pharmacy. Many retail pharmacies have medication lists where they only charge $4 for a 30-day supply of certain medications. Metformin tends to be on this list for many of these pharmacies. I would also advise you to check an independent pharmacy for any prescriptions not covered by insurance, because they tend to have lower prices. Well, that's all I have to share on today's podcast. I hope you enjoyed your small dose about metformin. Tune in next time for another small dose. Look for a small dose on Instagram, Twitter, or Facebook. Check the description box for links. Leave a comment if there are any medications you want to learn more about. I'm Dr. Charlene McCormick, and thanks for listening to A Small Dose.